Hi, welcome back to the Resting Stitch Face podcast. I'm your host, Dr. Erin Sheffield with
Dr. Sarah Harding.
Welcome back to another amazing episode. Sarah, do you want to introduce our guest today?
Yes, we have a very special guest today, one who I met a couple of years ago at an event here when I was about 22 weeks pregnant and she was about 18 weeks pregnant. And we kind of giggled about that because we just are all up in the chaos together. And she is an orthodontist here in San Diego and owns her own orthodontic practice. And this is Dr. Lindsay Pfeffer. Welcome, Lindsay.
Hi,
Welcome.
thank you. Thanks for having
All right. So Lindsay's joining us from just down the street. Lindsay, tell us a little bit about yourself, like where you came from, all of that good
Yeah,
stuff.
so I'm from Pennsylvania. My dad was a dentist. My uncle was a periodontist. And so, long line of dentists, I was not going to be a dentist. I actually went into cancer research and loved it. But once you do research, you end up having to do papers. And I was like, oh, I don't want to do papers. And so my dad passed away and I had to help run his office with my mom until we could get it sold. And so I had, at that point, I was in college, I was 21, and I had 14 cavities. And I had every single one of his friends come in and fill each one as they helped sub in. And I had an oral surgeon do a couple cavities. Each person was doing a cavity as I was helping with the office and just trying to keep it afloat until we sold it. And so I got to work with my mom. My mom was working in his office for 30 years. So that kind of, people would come in crying and bawling. And I was like, oh my gosh, he's just your dentist. But I didn't realize how much of an effect he had on people. And so it kind of just made me, at that point, I was like, I'm going to be a dentist because I had liked science, but I'm a total people person. I was not meant for the lab. I just liked having a purpose.
That's true.
And so I was like, I'm going to be a dentist. These patients are crying in the lobby when he passed away. So I got to see all these different dentists come in and try to help and watch and kind of babysit the hygienist. And so I was like, okay, I'm going to do this. So I went to Penn for dental. Then I was there and I still was interested in more. So I got a dual degree at the med school in biomedical ethics. At that time, there was not master's in public health, or that's probably what I would have done. But I was like, I'm just going to try to get everything I can get out of this school. So I did a lot of research and I did the biomedical bioethics degree. And then from there, I was like, I don't know what I want to do. I was like, general dentistry is too hard. I've got to specialize. And I was into kids, but I didn't know. And so I really wasn't between pedo and ortho. And so I was like, I'm going to do a GPR. And so that's how I got West. I went to USC and I did a GPR. And so I got to work on cancer patients, which I loved, but it was just too depressing for me. I'm such an emotional person. And I was like, oh my gosh. And so, because we were in a hospital setting.
Yeah.
And so I got to work on some kids. And then I chose ortho. It was just a more motivational age where you could just reach kids and get them excited. And it was an elective thing. I wasn't trying to talk someone into something. So I just loved that. And so then I went into ortho. I was like, I can't go the whole way back. I just got my Jeep here. I'm from a small town with no internet, no pizza delivery, no anything. Like TV was non-existent. I just got here. I'm not going the whole way back. And so I got non-matched and I had to tell within 24 hours before match started. And it was in Vegas. And I was like, I'll take it. I don't want to leave. And so I wanted to stay West. I was like, I finally got out. I had gotten out for residency. We had done a residency in London during dental school. And I was like, I just want to stay out. And so just see something different because I'm from a really tiny town, Pennsylvania. So I stayed. And then once I got there, I was in a private practice in Dallas, Texas. I loved it. It was great, but I missed the water.
I didn't know that.
Yeah. So I loved it. I missed the water. I'm a swimmer and Dan and I are just so social and we really wanted a place that was kind of a melting pot. And we had family that was in the Navy. So we came here to San Diego for a part-time job. It was planned to be part-time. And then it just ended up morphing into owning this practice. And so the female before me had rheumatoid arthritis. And so she was having to cut back. And so then I kind of took over after that. And so that's kind of how we got here. And Dan's from Illinois. So we have no family here. And he's from a really tiny town where nobody ever leaves. And so he moved here. And so, yeah, slowly we ended up with 4 kids, 7 and under, and we have no family. So we've been very lucky to have the Navy here and the Marines, since we have some family that get stationed here and can live with us. And so that's what we're doing now. We're like a little bed and breakfast. Military, now the DEA as well. So we've kind of just got people living with us at all times. So we have some help, but it's been nice. It's definitely different from where we grew up. You grew up where there's nothing. There's like one stop sign and one traffic light to this is like the big city for us.
Yeah. Where did you meet Dan? When along your journey
It
did
was
you meet
playing
Dan?
football in Vegas, and we lived on the Strip, and we lived in this crazy place where we thought it was you had to, it was safe. My cousin's a police officer in Vegas, and he was like, "It's not very safe." I mean, not that it's not safe, but it's by yourself as a female at night coming home from residency. He's like, "You got to live in a fortress," and we moved into a fortress, and we realized that fortress was just keeping all the crazy people in. So we were like the only people not in the industry, not a poker player or a stripper. The only people that I was showing up in scrubs. And it was like this, we both drove Jeeps. We were the only Jeeps in the whole place. And so, yeah, so that's where we met. And then he ended up going into, he builds laboratories, staffs laboratories with scientists and does testing, cancer testing, all that kind of testing. And then so that's what he does. He starts up, he gets the scientists, he gets the medical doctors, and he gets everyone together and builds a lab. And then he goes to another place. So right now he's doing that in Kansas City. So he's on the road. So it's been hard
Oh,
because
wow.
I've got a full-time practice. I've got these four kids that I absolutely love. And I got a 7-month-old and they've got all their activities. I'm not going to let them not do anything, but then I've got this practice. So it's been challenging. But once Brig got sick, I got an associate full time and I'm still there all the time, but it's just a sense of relief now because if I can't be there,
Yeah.
have somebody because it's a lot of stress. And my dad actually, he passed away of a heart attack. And my mom had told me he's going to have a heart attack. He's so stressed out. He's not sleeping. And he was a dentist. You're like, why are you so stressed out? But if you care, you're the person that
Right.
takes so much load. He would. Mom goes, if he looks at the schedule, he won't sleep. And I was like, that's how I am too. If I look at the schedule. And so he was that type
Right.
of person. He just cares too much. My sister's husband's the same. So he just retired after 30 years. And so he teaches at the dental school in Florida and he loves it because there's no stress in teaching. So when I
Right.
got out here, I was like, I've got to do something because, I'm in a higher end area. And I was like, I've got to do something to feel, I just enjoy my field and helping people. That's why I got into it. I love kids. I mean, I see a ton of adults, but I love kids. That's my jam. So I started the free clinic. So I started teaching at the free clinic because there's no dental school close to here. And there's a free clinic
Right.
in Lemon Grove and it's run out of a little school, which is so cool. And so it's down south by the border and they have a little three or four clinic chairs there and an x-ray machine. And I do the ortho and then there's a pediatric dentist. Everyone's volunteer. And it's really cool because the medical students, it's through UCSD, they have a couple clinics. There's only one ortho and there's a couple pedo and elder, and then there's some senior centers too. But the med students get to be the assistants for the medical part. The psych students get to be the psych assistants. And then they have pharmacy. So the pharmacy students get to be the pharmacists,
Oh, wow.
you know, and they have this makeshift clinic. And it's so cool because they don't have a dental school. And so actually, those kids that are pre-dental get to do what normally dental students would get to do. They like run the clinic as a
Oh, that's really
pre-dental.
cool.
So it's so much easier
Yeah.
for them to get into dental school because they're buying the supplies, seating the patients, treating them. They're assisting me. They're my assistants. So these pre-dents get to be my assistant. And it's so cool because these little kids I remember a moment that I was telling a little kid, I was like, you're going to have to go home and swish with salt water. And he was like, I don't have salt water. And I was like, you don't have salt water? He's like, no, we live in our car. And I was like, this is crushing. Like they don't even have salt because you can't give them like Listerine or any sort of mouthwash because someone could drink it or something. So when these little kids have infections, so they will do their cavities, will pull teeth. I do ortho specifically just so they don't have to get impacted canines, like big stuff that's going to take out their front teeth and so they can eat. And so this free clinic's really cool. So that's kind of what I did in addition to my clinic
Yeah.
is tried to do that because they make me feel like Mother Teresa. I'm trying to help them. And it's really gratifying.
Right.
To say. So yeah, that's kind of
Yeah.
what I've been
As if you needed anything more on your plate,
doing.
right?
Yeah.
And so when do you go there? I've never even heard of this place. When do you
So,
go there?
so they have clinics once or twice a month, and they kind of
Okay.
have them all over. But I did that for like 5 years until until my fourth was born. COVID hit, and then I went
Okay.
back after COVID. But then after that, after the fourth, I would stop. But it's so great. It's like 6 to 8 p.m. So when the school gets out, then people line up, and it's this little kid that I was helping. His mom,
Oh, okay.
she has she's working, but it's just so hard to live in San Diego.
Yeah.
But it's nice because they get pharmacy, they get psychiatric, they get medicine, and they get dental. And so it was the one area I could help in because a lot of the times, like the Ronald McDonald Clinic and these really good senior centers and stuff, I can't help. I mean, I can assist, but I'm not. It's been a while since I've done a root canal or a filling. Oh, I extract baby teeth for
Yeah.
free all the time. But yeah, it's really cool. you get to teach, but then these kids
Yeah.
get to see like real life running a clinic, like actually running the patient portion, calling them, scheduling them, ordering, doing all the stuff. It's really, really a neat concept. So anyway, it was very
Yeah.
fulfilling.
'Cause it is really hard to get into dental school these days. You
Yeah,
know what I mean? There's very little that can set you apart, that
yeah,
can make you stand out. You
yeah,
know, they expect so much of you
yeah,
to even just get in. I don't think that there's any way that I would get in at this
yeah. It's
point.
hard. It's hard.
And so interesting, and so it's nice to have that to set them apart.
Yeah.
So you guys moved were you living down by the beach and then you moved to where you are now?
Yeah, well, when we first moved,
Is that
we
right?
don't know anything, so we moved to Mission Valley, and then we moved up to the beach, and we were at the beach. But I came from a really small town, and Dan came from an even smaller town. When we went on Disney cruise, he was like, "My
Yeah.
town is smaller than this Disney cruise." So he was like, "I want land," and you can't really get land. He's like, "I want to pee outside," and I was like, "I want to be where if I scream, someone hears me and comes and helps me." And so we moved to the burbs, and we're we are just in track housing, next to Target, which I love. I just was like, I've never
Yeah.
neighborhood feel. I want a block party. I want to feel really close to people. And he was like, I don't, but we compromised and we ended up
Right.
yeah, in the burbs. So we slowly made our way up to closer to my office.
Okay.
He flies out to Kansas City a lot for work. And so he's gone for longer periods of time where I was like, I really just want to be now it's nice. If someone calls with an emergency, I can be like, just keep them there. I'll be there in 6 minutes. And so people can come in at any
Oh,
time
wow.
and I can
Okay.
just bounce down. Today I'm going to go in for a surgery patient actually, and just going to take the baby because it's like 6 minutes away. It'll be a quick appointment post op. And so anyway, yeah, it's been nice for me. It's a little less stressful than even if it's 20 minutes away, it's still 40 minutes. And um
Right.
life. I do go in for a million emergencies and you're like, "How?" And it's because when it's an infected tooth, the dentist is like, "Just take some medicine and we'll see you in a little bit." But when it's a bracket or something's poking, people just get all up in arms. And so
Yeah.
I come in, have to go in all the time, even though it's like, just put some wax on it. It's like, nope, I got to go in. So I go in a lot. And so it's just nice to be close,
Yeah.
to do something for 2 seconds and then make someone happy instead of making them mad. So it's kind of been a strategic thing, but definitely harder. I mean, up north is harder than working down south, but
Right.
it's just for ease of lifestyle, I think.
Yeah. And I often make the comment, like, if I call us your friendly neighborhood oral surgeons, but you are truly the friendly neighborhood orthodontist because you send your kiddos and their chonies to people's front doors delivering retainers. Is that
I
right?
do. That's true.
What?
That is true. Yeah. They just love it. They love it. And so I'm like, okay, I'll deliver your retainer. The kids think it's so fun. And actually, that came in return this weekend because my son, my 7-year-old, fractured his front tooth almost down to the gum line. And I was like,
No.
oh. So I couldn't find the tooth anywhere. I don't know where it's at. I didn't know if it was intruded. I was like, you're going to lose your tooth forever. I was being dramatic. And I was like, this is what dramatic leads to. And I couldn't tell if he intruded it. I could not find the tooth. So I'm like, oh, he fractured it. So anyway, he's going to be toothless for a while. I was like, I'm going to let you live with that one for a little bit. And then you'll figure out why you were not dramatic. And then I told my sister's husband, I said, I'm not going to give any dentist that stress. Cause he said, Lindsay, I restore these and every 4 to 6 months they break. And I was like, I'm not going to put that stress on any other friend of mine or you're going to teach me how to do it. Like I'm back in GPR. And every time he doesn't appreciate the time it took and all the labor that went into it and the love, and he breaks it again on a sandwich or a pizza, I'm going to be in there restoring it with him. And one day when he understands the responsibility of that tooth and how hard it is to maintain for the rest of your life, he can get a crown when he's like 18. So I was like, I can't. He goes, I'm fine with it like this. And I was like, you're fine until we have family photos or you're 12. And I'm like, why is he not?
It's still at the same. Like, is that tooth ever going to
So
erupt
I
or
know.
what's
So the favor was returned to me this weekend. I had a Dr. Bragio, that's a shout out to her and her husband who assisted. I should have been assisting, but he insisted. And they helped him get that tooth not sensitive, but oh my gosh, what a drama. Didn't even make
what a
it
mess.
7 years old with the first child before someone like almost knocked out a tooth. I was like, what are the chances? So
Yeah. Man, speaking of 7-year-olds, mine hasn't lost any of his baby teeth.
I
So here we are.
yeah,
Yeah,
I
so I'm
have
like,
like
that's the one that you want to knock the tooth.
yeah, yeah. Exactly right.
So, can we talk about something that's very hot right now in the orthodontic slash
Oh,
oral
yeah.
surgery ENT community? Can we talk about airway dentistry?
Oh yeah.
What is your thought process on that? Because I am seeing stuff all over the place, like your teeth don't fit because of your airway, and never, ever, ever take out teeth, and everyone needs expansion.
Yeah.
And it kind of to me feels like I've got a hammer, so
Yeah.
everything's a nail right now. But I'm just so curious about different orthodontic philosophies because some orthodontists seem like super on the airway train. Some seem like they don't believe at all. I suspect there's some middle ground.
Yeah.
But what are you telling patients these days when they ask these questions, or how are you treating? Are you expanding everyone? Is airway on your mind?
So I am expanding a lot and airways on my mind, but I'm definitely middle ground. I honestly think it's just like some people just want the new thing to sell. And that's,
Mhm.
at this time, airway. And so I feel like you can definitely see airway improve when you do expansion, and you can definitely fit teeth in and not have to pull. And I will tell you, when you live up north, you don't pull teeth. Nobody wants teeth pulled. It's just not an option. And I wouldn't want my own kids' teeth pulled. My kid has
Mhm.
9 cavities. I brush his teeth diligently, but he's a milk addict, and it's like his happy pill. When he takes milk, it's like he had a Starbucks. He's the happiest kid in the world. So I'm not going to neglect him from that. And so I've brushed his teeth. He still has 9 cavities. So I was like, I'm going to expand when he's little, not too little, but expand so that I don't have to do ortho. I would like to not have to do braces. I would like to then jump into like aligners or not something more difficult and not have to do long-term braces with him. Although I have a ton of patients in braces, and braces are definitely best for bites. Aligners are best for closing space, making things cute,
Mhm.
decorating. That would be my
Mhm.
philosophy if we were like, on trial. That's the honest truth. But I have to do backflips for people all the time because they want this, but they don't want this. And they want, and so we do backflips and we'll do braces and aligners or something. But with airway, I feel like it definitely has improved. But there are people then all of a sudden that want to get every patient. So it's just like Invisalign. There are a lot of dentists that they think every single person should have Invisalign. I have a lower incisor that is a tiny bit crooked, and I am not doing Invisalign because orthodontics is organized trauma, and it isn't necessary if I can clean the tooth. Now, if I was hitting it, yes. Or if it bothered me aesthetically, yes. But you do not need to do orthodontics on every single person. So a lot of people come into me and they're like, do I need ortho? And I'm like, not really. Like, if you want it, for sure, but it's a luxury and you don't absolutely need it. There are definitely times to do it. It's the same with airway. Like, there are kids that come in and they can't breathe, they're snoring. They should not be snoring. If your kid is snoring, it makes total sense to do an expansion. If the kid's teeth are not going to come in, it is very easy. I take a pan to the little kid's school and I do a picture and I go, are these teeth going to fit? And the kids are like 5 and they're like, no, there's no way those teeth are going to fit. But then there's x-rays where you take a pan and you're like, those teeth are obviously going to fit. They don't need expansion. And so not everyone needs it. I tell patients it's based on the size of the cars and the size of the parking lot. If the parking lot is
Right.
large and the cars are small, everybody's going to get there. And I never needed ortho. My dad was a dentist and I did not do ortho. My sister had teeth pulled. She would be the person now that does an expander. I don't ever have to pull teeth. The only times I pull teeth are if someone didn't get to me soon enough for expansion, or if the teeth
Mhm.
are like out.
And what age do you recommend?
So usually you see an ortho, they say by 7, but I'll be honest, some people aren't ready till they're 10. So it's more just babysitting. Like, I see them at 7 and I'm like, you're not ready. I'm not even going to take an x-ray because I've told patients before, if I take an x-ray too young, everyone looks crowded. It's deceiving. It's like fake news. Oh, you look crowded, but that's because you're tiny. When you grow a little bit, now people say, well, aren't they just going to grow and fit their teeth? They're going to grow, but there are kids, it doesn't matter how much they grow. They're not getting those teeth in. And so there's a
Right.
time, usually around 7 or 8, where you take a pan and it's pretty obvious if they're gonna fit, if they're not, or if they're borderline. And borderline is like, you just wait and see, or you can do something. Like, you could do something glittery or glow in the dark. It really is that now, like, there are pediatric dentists are jumping on the train. It's just like now every pediatric dentist, or not every, but a lot, general dentists are now, everyone's airway, airway, airway. So everyone's getting their tonsils removed, their adenoids removed. Those are surgeries that can have complications. So anyway, so, people, no, there may be only 10 kids that die a year, but like, I don't want to be one of those 10, for a surgery I didn't absolutely need. And so I think some people are just jumping on, it was Invisalign. Now they've gotten everybody with Invisalign. So now we're going to jump on airway. And I do think airway is important. It is
Mhm.
absolutely, I see patients all the time. Their faces are like, almost looks like adenoid faces, long face, black eyes, like kids are not sleeping. You can just tell by their face they're not getting good airway. They're snoring. Their mouth is open. Absolutely do expansion. And then we send them to myofunctional therapy because the tongue placement is huge too. And there's some people that think like
Mhm.
is like tarot cards, but it's not. It is actually
Mhm.
legit. and works if you have the right person, not a person that like took a weekend course. So I refer
Right.
to a myofunctional therapist that actually has occupational therapists in their office, and they go through medical and they do the right stuff. Because I'll make space and then they'll go back to being narrow if they don't have a retainer because their tongue is pushing
Yep.
forward, their cheeks are pushing this way, and they'll go narrow again. And there's times where I can see someone's lower jaw is back in their throat, which puts their tongue, but they have a recessed mandible. So their tongue is back in their throat and they're not getting airway. And all I have to do is bring that jaw forward. I can do that easily with a retainer at night. So there is things I can do to change the face with expanders, headgears, for underbites or excessive overbites. There's things that you can do to actually change the bony structure of a kid. One, make their airway better. Two, make them less self-conscious. Three, avoid surgery all the time. Avoid pulling teeth. All these magical things you can do at 7, 8, 9, and 10. You have to do it, even 11 or 12. You have to do it before they stop growing. So in girls, people aren't supposed to stop till 14, but we see girls that are even earlier, 11 and 12. So there are these things that you can do. One, I will tell you, it is much easier to do an expander on an 8-year-old than it is a 12-year-old. And it can take
Yeah.
6 months. I can finish all their treatment in 6 months and they're like excited about it. So there's so much you can do
Mhm.
because they're happy and excited about it. And it doesn't have to hurt. My expanders are glued to baby teeth. I don't glue to permanent teeth. I don't want to glue to anything that has to last them a lifetime. These teeth are going to fall out and the expander's going to be in for 3 months. So I don't have to worry about cavities. Like there's all these great benefits, but there are kids and I have friends that are like, oh, we put an expander in at 2 or 3. And I was like, you're going to widen their nose. Like nobody told you that small fact. You can't just go in there widening early if they don't need it because I don't want to widen their nose. So there are things that people don't worry about. Now that makes sense if the person's nose is like, and they're not breathing, but we just can't treat
Mhm.
everybody like an expander case. Everyone has airway. I mean, it's
Yeah.
just not, people go overboard and it's,
It's just the broad brushstroke, right? Where they're like, "Oh, well, everybody needs this." But just like you said, sometimes you've got big teeth and small jaws, and sometimes you've got big jaws and small teeth, and, like, not
Yes.
everybody needs it.
exactly right. Exactly right. And it's just so sad. So with my son, I was like, oh, I know he needs it. But I was like, I don't want to widen his nose, so I'm going to wait until he's like 7. I can tell that, okay, now nothing more is going to come in. He's got room for 3 incisors and he needs 4. And I also I didn't want to do braces on. So I was like, I'll do some removable expansion. But
Mhm.
I do tell people now they're all like, well, everyone else is starting. I'm like, when you start the party early, you have to be at the party longer. So we would like all the guests to
Mhm.
arrive before we start this party. So the party could be as short as humanly possible. So I know what your friends are doing, but what your friends are doing is not always, that's what someone told them, right? So it's just
Mhm.
sale item, which is really sad. So I think they're just like, it's the next big thing to sell. The same, like I had a friend that was like, are you doing CBCTs on every kid? And I was like, no, I'm not, because I would not want my kid to have a CBCT if he doesn't need a CBCT. I have a pan machine.
Right.
I'm not worried about radiation, but like unnecessary is unnecessary. And I don't take a CBCT in a person that has a class 1 bite that doesn't need ortho. I'm also not taking a CBCT on a little kid that doesn't need ortho, like doesn't need it. I was like, it doesn't make sense. Now, if someone
Yeah.
needs a CBCT, then I send them to get a CBCT and I take them to the person that's going to evaluate the entire CBCT, not me that just looks at the one part and then ignores the rest of it. I'm like, if you're going to pay for CBCT, I want you to get the full benefit of it from a medical professional, but also like, no, because I wouldn't want to do it to my own kid. I also don't take x-rays like just to take x-rays. I want to see something. So when kids come to me and they're really little, unless they got a crossbite or an underbite, I'm not going to take an x-ray because it's going to look more crowded than it should, and you're going to think they need something out now.
Mhm.
It's going to look worse than it is. Let's wait till some teeth come in and then take a look. Like if I looked at your kids right now with no teeth out, it would look like they absolutely need expanders. Nothing's going to come in. But if I wait a little bit till a couple of
Right.
teeth come in, then I can say, okay, now we have a valid x-ray. And now I can use this x-ray to actually make a good judgment call. So yeah,
Yeah.
it's kind of just,
So you do you find that you often get patients probably a little bit later than you would want to get them? Because I find that as oral surgeons, that's what I've really noticed is that the general dentist or the pediatric dentist is sending patients like when all 4 wisdom teeth are developed,
yeah.
and then they say it's time.
Yeah.
But I would have so much rather seen you before those roots were all on the nerve, and then we can stage it.
Yes.
But I find that they're coming so late, and so it's increasing the risk. So do you find that too?
Yeah. And so that is one of the things, like a repeating, just, one of those audio recorders. I should just push a button because every time I take an x-ray, I'm like, listen, I got mine out in high school or in college. My dad pulled mine. It was awful. And I said, and it was in college. They don't do that anymore. You realize it is much easier to take a bulb out of the ground than a fully rooted tree out of the ground. And this ground is bone. And so I was like, insurance companies only do what benefits them. And they started covering wisdom teeth earlier because they realized there was less
Mhm.
risk if it's not wrapped around the bone, and
Yeah.
it's less risk if it's earlier. So the fact that insurance companies are covering it earlier means that it's actually better to do it. So I was like, no, you can't do it if it's a seed. Some people, you look in there, it looks like a little ghost. That's not a tooth we're going to take out. But yes, when it starts being a bud and starts to form those little things, like as if it's going to start to do legs, that's when you go to the oral surgeon, and the oral surgeon will babysit it until it's time to do it. Just like dentist or pediatric dentist should send me the patient, and then I will figure out when is the best time. We don't just want to fix a deep bite in a small kid. If the deep bite is the upper incisors, I don't want to push them up and not show teeth when they smile. Sometimes a
Mhm.
deep bite is just like back teeth need to grow in, so they just need a retainer, or they don't need anything. So it's sometimes where I don't need anyone to figure it out. I just need them to lead them to the horse, and then I will kind of babysit that issue and tell them when you have to worry and when you don't. When things are just normal, it is normal to have an overbite and a deep bite when the only teeth in are your front teeth. Those are the ones that came in.
Right.
So it's not something we have to worry about, and we don't have to fix everything. We don't have to get in there and start pushing and putting
Yeah.
organized trauma on teeth for no reason. So yeah, I do feel like the earlier the better, but now I have the reverse where people are like not even getting to me because they're starting and they're doing $6,000 worth of aligners, and I'm like, now you need actual expanders for 4,000 or 3,000. Why did we spend 6,000 when we could have spent 3,000 or 2,000?
Mhm.
I
It's
had a
not so
patient
efficient.
recently that was, like, the most retrusive mandible I've ever seen, to the point where I was like, "We're supposed to be doing wisdom teeth in clinic, and this is not a great airway, and I guess we'll go ahead, but we'll stay a little light and ugh." And I was like, "Wait, you're done with your ortho?" Like, did your orthodontist ever say say anything? And you're trying
Um,
not to plant a
yeah,
seed of dissatisfaction because 'cause they've already done
yeah,
thousands of dollars and years worth of treatment, but I'm looking at 'em going like, "Oh, this is
yeah,
bad," and, "Oh." So you try to frame it as like a functional thing, like, "Hey, I just worry about long-term airway." And they're like, "Yeah, he snores really bad." And you're like, "Oh my gosh." And you don't know, and the dad's there. And so you don't know if they said something to mom 4 years ago. And
yeah,
she's like, "My son is the most beautiful, and I can't believe you would say
Yeah.
that about them."
yeah,
And
yeah,
so they didn't, or if it really wasn't presented to them or not. I don't know. Those kind of
yeah,
situations are so frustrating when it's just kind of a little too late, and
yeah.
you're just like, "Oh my gosh, your mandible needs to come like 2.5 centimeters forward,"
Mhm.
and no one said that, So I wish
Yeah,
people would let us, weigh in a little bit more as the experts on the consultation before these things are decided
for
or
sure, for
done.
Yeah. Is there anything as an orthodontist that you wish that other referring people knew?
um,
Like, we have so many things, right, that Aaron and I talk about all the time of like, gosh, I just wish that they knew this. It would make everybody's life so much easier.
it's funny. It just happened that there's all this kind of overselling on airway, but I think for me, prior to this, it was really that people think you're just trying to sell them 2 sets of braces, and people be like, "Oh, I don't want that 2 sets of
Mhm.
braces." I'm like, "I don't really care if you do the 2nd set. I just care if you do the 1st set." Because the 2nd set,
Sure.
and I tell patients, the 2nd set is decorating. Yes, I'm fixing the
It's
bite, making it
landscaping. Yeah.
perfect, but you're not gonna die of a class 2 bite. You'll grind on your teeth, get a night guard. But phase 1, if you need it, and not everybody does, but if you need it, to me is way more important than phase 2. Because if I can make room for your teeth, I don't have to put trauma on your teeth. And I actually didn't put trauma on anything because I just put an expander in on baby teeth and your maxilla moved because you were growing. So it's one of those things where I think for me, I've always been like, if people only understood what phase 1 can do, it just makes it makes people not, they could do aligners, they could do no treatment, they can do, you know what I mean? Where if you don't do that, you are pulling teeth, you
Mhm.
are in braces for a long time, possibly getting cavities, still putting trauma on teeth that don't need it for 2.5 years. The more you do now, the less you have to do later. So I feel like there's a lot of like, oh, I don't want that 2 sets. That's the most dangerous thing to me is that people think that we're just trying to sell them something. I'm like, actually, if you did this little thing, which costs less than of what you would cost paying for braces, it would make all the difference in the world. And then you could decide Like,
Mhm.
oh, I don't want to do anything. Like, I don't like the way this little tooth looks. Like, all these little things. Like, I don't have a perfect bite. I don't have to have a perfect bite. I'm fine. I sleep like this. If you
Mhm.
sleep with your mouth open, you don't grind. So it doesn't matter. The only time those teeth are touching is when you're eating. So it doesn't so much matter. Bite's not perfect, but it does, So if you're a grinder, great, get a night guard. So I just think that's probably the thing for me is that they're prior to this or airway thing. But the problem with the airway thing is now everyone thinks they have to do surgery on every kid and it's got to be before they even get to me. So I don't even see them until after they've had all this stuff. But I think prior to that,
Yeah.
and it still does happen, there's like two opposite camps. And I don't do the wait and see. I'm like, listen, back when I was a kid, they didn't have digital x-rays. So I tell patients, they didn't take an x-ray until something didn't show up. And by the time something didn't show up,
Mhm.
they had to pull something. Nowadays, we have digital x-rays. It's like flying on an airplane, eating 6 bananas, or having a basement in your house. And I can take this one x-ray, this pan. I don't even need to take a ceph. I just need a pan to see if your teeth are going to fit. And from that x-ray, I can see if you're going to need something and I can prevent that accident from happening. So now things are more proactive. They're not reactive. They used to be reactive. Let's wait till there's a car accident and then try to save everybody. And we might lose 4 members. Here, it's like, no, let's just prevent the car accident. We can save all the members of the family. And then if we want to move those around and make them cute later, then we could do that. So I feel like that's my, kind of my horse that I die on is that like, I've seen the benefit of a little kid not needing jaw surgery because I did a headgear because they had an underbite and they had no upper lip. They were getting made fun of, and they look like a denture patient that hasn't had dentures in a decade, or a huge overbite where they're going to get fractured teeth and they've got no lower jaw and they're not breathing. And I can take that and make them class 1 with just some expansion and some retainers to bring the
Sure,
lower
sure.
jaw forward so they can grow in better position, more like a posture appliance. And so I can do these things that like, prevent jaw surgery and like prevent just the meanness of kids making fun of you at school. Unlike
Yeah.
it is, confidence is everything in a kid. Like, they don't have to be good at anything if they're confident. And so I feel like those are the things that you can just do so much in phase 1 and kids are excited. There is no teenager that is excited about anything orthodontically. Life doesn't get easier as you get older, it gets harder. And so when you can get a kid
Right.
excited about colors and jewelry in the mouth and glittery and glow in the dark expanders, the world's your oyster and then everything else is just easy.
Yeah. Yeah, and then, like, insurance isn't covering. I think they used to be better about covering jaw surgery for
Oh, yeah.
functional issues, and now they just don't cover it at all, and
Yeah.
so if you can prevent all of that,
Yeah.
even better, right? Because it's almost out of range for most people to be able to afford this huge surgery.
I think
Yeah.
there's so much distrust in dentistry. It's funny to me when it bleeds over into ortho because I feel like ortho is the promised land of dentistry. Like you're the one
Mhm.
dentist that people admire and love, and you probably
Yes.
inflict way more pain over a
True.
lifetime than any of the rest of us. But it
Mhm.
happens at home, so they don't realize it's you or they don't
Mm.
think about it being you, right?
Yeah,
Yeah.
and you
But
probably get Christmas presents in your office
yeah,
and
exactly,
treats and
but
things nobody brings
anytime,
us.
like, you get on these physician forums or
Oh,
these Facebook groups or on Threads or something, and it's always like, "My dentist, are they trying to scam me? They
yeah,
want my
yeah,
kid in braces at 8."
yeah,
The big jerks. "We never had
Mhm.
braces till we were 21, and I think they're
Yeah.
trying to scam me." And I'm always like, "No, mm-mm.
yeah,
Two-phase ortho is never a scam,
yeah,
and the palatal expander is never a scam. If
yeah,
they're asking you to do that, we are all in on that, baby. This
yeah,
is the exact opposite of a scam. This
yeah,
is
Yeah.
early intervention saving you from so much trouble and heartache later."
yeah,
Yeah.
So,
yeah.
So, speaking of snake oil salesmen, which they all think that we are, there are plenty that do appreciate what we do, right? But certainly a lot of people do think we're snake oil salesmen. But I'd like to talk a little bit about your huge life event that happened
Yeah,
2 years ago, almost to the
yeah,
day,
almost.
right? It'll be like next month, right? So a couple of weeks ago, we had an episode where we were talking with Erin about her mission trip to Eswatini, and we talked about they have these remote. It's very remote, right? And so they have people all over the place, and they have a big issue with, is it black mambas? Is that what it
I
was?
think they have so many different venomous snakes, but black mamas are a big one there.
Oh my
Okay.
god.
And so they have these drones that come and that they can load antivenom onto. They can send those drones out to these remote locations and they're GPS guided. They can go and they land and the people can get the antivenom. They can draw lab samples and send them back and do all of this stuff totally remotely. And so I'd like to know a little bit about your experience with venomous snakes.
So, I come from a really tiny town in the middle of nowhere I lived in the woods. My address was RD1. Everybody was road 1. There wasn't even an address. Dan's from the middle of nowhere on a
Wow.
farm, and neither of us had seen a rattlesnake in our lifetime. And then we moved to the burbs behind Target and track housing. And when we moved in here, we saw a snake egg. And the night we moved in, heard the kids heard a rattlesnake, and I thought it was a sprinkler system because I didn't know what it sounded like. I've never seen one. And I was like, oh my gosh, it's a
Yeah.
rattlesnake. And I had the person come the night we moved in, remove it, the wildlife person, and I took every bush, everything down to the ground. It was all cute, looking like Palm Springs in my tiny backyard. And I was like, take it all down. I want nothing in this yard because I cannot live and sit in my yard if I've got snakes. So we did
Right.
that. And that was,
And you had how old were because at that point you had 3
yeah, I
kiddos,
had 3 kiddos,
right?
but
When you
Briggy
moved in?
was
Okay.
3 months old. And then
Okay.
come Briggs turns 2 years old. And a couple days later, we're outside. We're maybe sitting, I don't know, 4 feet away from him. Dan and I are both looking at him. The 3 kids are playing in the water fountain. And we're watching him, and I don't hear anything. And Brig comes over and he gives me his hand. He goes, "Eh." And I was like, I looked at it, and he had, just turned 2, so he can't tell me what's going on. And I was like, it looks like there was one little spritz, like as if you opened up a LaCroix. It was a white spritz on his finger, not even a drop, just a spritz. And I was like, well, that's weird. He's on cement. He was on cement by the fire pit. I don't see anything. And I was like, that's weird. How did he hurt himself? Like, he didn't fall. I was standing right here. And so my sister's deathly allergic to bees. And so I said to my son Binghamton, who at the time was 5, him and Penley, and I said, can you just check and see if there's bees over there? Because I don't know. None of them have been stung yet. So I don't know if they're allergic. And so he was looking from a different angle. Like, I was looking like this way at Brig, and he was looking this way. And Binghamton yelled snake, and it was hidden behind the fire pit. And I ran over like within a minute from when this happened, looked up, and he was all coiled again, ready to strike. And I was like, oh my God. And so I picked Brig up, and there was no bite mark or anything. I ran him to the front, and Dan was going to get the keys to drive him to the closest ER. And we got on 911, and he was in his underwear at the time. And we got it at we laid him out on the sidewalk, and we called 911, and they go, don't go to the ER because the closest ER to you does not have antivenom. The closest ER
Mm.
is Escondido, which is 25 minutes away. And we were like, oh my gosh. So we waited 13 minutes. I still have it screenshot on my phone. We waited 13 minutes for the ER or for the ambulance, which isn't their fault. It's Saturday. It's busy. And it was interesting because the week before we found a lady had fallen over and went into cardiac arrest on the side of the road right at our house and got in. And, that time it was 3 minutes till the ambulance came, and then you have your own medical emergency and you're like, why? And so,
Yeah.
it was 13 of the longest minutes of my life, but his hand was starting to turn black. And it was going up his hand and starting to turn black and starting to swell. And he went unconscious at that point. And so they came and they put him in the ambulance. I went with him, and he was losing in and out of consciousness. And they were trying to get an IV, and they just could not get an IV. And it was just, I think when he left here, it was to here. When we got to the hospital, it was like to here. And then by the time we got there, it was to hear the blackness and
And she's pointing to almost her elbow
almost my elbow.
to people
Yeah.
who are listening.
And so, yeah, sorry. And so, it was my hand by the time the firefighters got there, my elbow by the time we got and so they said the closest place is 25 minutes away. So we go to the closest place. And when we get there, they have a ton of rattlesnakes. Escondido's like rattlesnake. I would think it like rattlesnake snake city,
Yeah.
I feel like. And they were like, well, we
Yeah.
don't have a kid person. We only have one kid person, and they're in an emergency C-section. So they had a hard time. It was like 30, 45 minutes and still had not gotten a vein. And I was losing him. I could tell his blood pressure was crashing. I could tell in the monitors we were losing him. And I was like, oh my God, he's going to die. Dan's not here because only he was with the other kids, trying to make sure the other kids didn't get bit by the snake. And then he was going to meet us at the hospital. And so everyone was being super calm. And I was like, I actually need people to be like ER. I don't need you to be calm. I actually need you to act like ER, like this is emergency, because everyone's like trying to be like, it's okay. And so they couldn't get a vein. I was like, you got to do something. And I was
Yeah.
like, I don't want to yell at anyone, but
Oh
I feel like me being calm is actually not making people work harder. And so I was like, we have to do something. He's dying. And they were like, well, the only thing we can do, doctor was like, is inject him in the leg. We could do an intraosseous.
well, yeah.
Like, you could inject him in
Right.
Yeah.
like,
I was gonna say, why aren't
I
they
mean, this
doing
is like
IO?
PALS 101,
yeah,
right? Like, holy
so I
shit.
was like, "You can
Sorry.
inject him in the head, I don't care, just drill. We have to drill through his leg." I was like, "Drill anywhere." So they drilled through his leg and finally got something in. And then at that point, we stayed for an hour while they got something in, and it just looked like his hand was gonna burst. It just started swelling, and there was no blood going to his fingertips, and I was like, "Oh my god, he's gonna," I was like, just immediately, I'm like, "There's no blood going to his hand. He's gonna lose his hand," right? It looked like gangrene. It was crazy. And so they're like, okay, we're going to transport you now to Radies, which now that we're 25 minutes up north is like 50 minutes. I don't know, 45 or something down south now. So now we got the 10 vials in them. But and so anyway, so we got transported to Radies. When we got to Radies, they were like, luckily with
Which is the children's hospital here in
Children's
town.
Hospital, which, the good thing I learned
Yeah.
out of this is like, okay, first of all, you got to call 911 because everyone doesn't have it. The closest ER to us is 10 minutes, doesn't have it. Second of all, you have to take an ambulance because you got to get VIP entry. You got to get right in the door. You don't have time to sit and wait for a front desk person to figure out if this is an emergency. And you also need someone to try to start an
Mhm.
IV. Even though they were not successful, they should at least try. And so
Yeah.
we then went to Radies and they were like, we need to take that out of his leg immediately. And I was like, you're not taking that out of his leg. And I was like, you are going to have to fight me to take that out of his leg. You're not taking it out till you get a vein. Well, here we had found out later because his platelets were 13 that they were like, we don't know if it's helping him or killing him that it's in the IO because they had never done it before and they didn't know its success rate because really it should be in a vein. It shouldn't be intraosseous. They still had a hard time because the venom shrinks your veins. And so they couldn't
Mhm.
get it. And so they got an ultrasound tech. They finally got a vein and they were having trouble with it the whole time. It was so shrunken that every 5 seconds the beep would go off that it lost, access. And you were just like, oh my gosh, I don't know if he's getting this drug or it's just going in his soft tissue. And so it was just heart wracking. So they finally took the thing out of the leg and they were like, essentially, we couldn't tell you this then. They told me the next day that essentially they all went and got to Sacramento and got with everyone in Sacramento and all the doctors in Southern California were like, we don't understand how this kid's still alive because his platelets were so low. And he was internally bleeding. I mean, at that point, the black was up to here, it was up to his shoulder. His chest was swelling, his face was swelling. And they were like, we don't know how he's still alive with his platelets at 13. And we were so worried that that IO wasn't working. At this point, he still was unconscious. They had to put him under, right? And he was still unconscious for like 3 days. And he ended
And
up,
so they intubated him, right? He was in the
yeah. And then
ICU. Okay.
he was in the ICU. And then they needed 30 vials. It was 30 vials of antivenom, which I mean, I think like in an adult, it's like 10. I don't know. So it was 30 vials in his little
Wow.
body. He was like 20 pounds. So he was, obviously like they blister and those big boils blister. And
Mhm.
that's the only way we could actually tell where he was bitten was because the boils and these giant blisters that were like, oh my gosh, they're just like huge, like, 2 inches wide were busting open. And it was just like, oh my gosh, it was just, it'll break your heart. So they thought he was going to die at first. And then they thought, okay, well, if he makes it, he's going to lose his arm. But that second vial, like,
And this is his right hand, right? Dominant hand?
yeah, I could see the
Okay.
light. Like when the antivenom went in, I could see like crazy magic. But then all of a sudden I saw some white at the tips of his fingers and I was like, oh my gosh, he's getting some blood to there. So he had like hematomas in his chest and he had this twitching in his face and they were like, it's the toxins running through his system. So his face was, I have a video, his face was twitching, even though he was unconscious. And it just kind of rocked his world. So now they're like, we use it for drug addicts and we use it for other things, but we don't normally use it for any venom. And we're not sure that how well it works and its efficacy. It's only been studied in like sheep or whatever. So they're using them as a white paper, which is the good part of it. Like they're going to be able to educate other people that if you can't find a vein, don't
Mhm.
let a kid for an hour and a half sit there and just get worse. But, I kudos to the person that did it in the first place. There's no fault on anyone's. I just felt like I was a learning experience. And I was like, why? Why am I a learning experience?
Mhm.
This
Right.
isn't the first rattlesnake. Because I asked the firefighters that came, I was like, how often do you get one of these? And they're like, once a week. They're like, but it's not a kid. It's a mountain biker, adult mountain biker. And I
Wow.
was like, oh. So the fire department took the pictures and started to educate their thing. I went around to all the nurses at all the schools because there's been rattlesnakes at every little school around here. And just because you don't know how much time you don't have, and like last week, a 25-year-old died of a rattlesnake bite in Orange County. He was in the ICU for
Mhm.
months. Like we did everything to the second. Like we knew right away, and he still almost died. And we have a children's hospital.
Right.
So
Yeah.
I really started like investigating it later, not because thought anyone did anything wrong, but more that I was like, access to care is kind of ridiculous here. There are snakes every day in this neighborhood, the rattlesnakes.
Yeah. Yeah,
It-
same here. On our little Facebook page, it's every day
Every
there's, like,
day.
somebody else posting a picture of a rattler, yeah.
Yeah, and this is like Kid City. There's kids everywhere. I feel like it's like a cycle and
Yeah.
nobody knows one, where to go, two, how immediate it is, three, wiser. So a lot of people were like, well, antivenom is expensive. And I'm like, well, I understand it's expensive. But it's also expensive to waste all this time, and so, like, for instance, the bill for Escondido, which I was at that hospital for about an hour and a half, maybe 2 hours max, right? 1 hour to get the stuff, 45 minutes to wait, and then we rushed, right? So 2 hours max. It was $170,000. I went to Rady's, and I was in the ICU for 3 days with every single specialist under the sun. I can't tell you how many doctors we saw because they would bring all the toxicology people in from all over because he was like this miracle child that he wasn't supposed to live, and he lived, and he did IO, and everybody wanted to run 1,000 tests on him. It was $170,000. And so I was like, wait a second, that's weird. And I don't
Hmm.
care. I'm not going to fight it. But I was just like, how is 2 hours the same price as ICU, multiple specialists, all
Hmm.
these things? And it was like, well, they charge $9,000 for a vial of venom, and they charge $3,000. What? Like, what? It
Why?
was the end.
Right.
And so we were like, "Well, Anavenom's really expensive." So I called Arizona and I was like, "What do you do?" And they're like, "Oh, everybody's ready. The ambulance comes. Everybody has antivenom. We use Anavip. It doesn't have to be frozen. That doesn't make sense." And so I called Anavip and they were like, essentially, they don't want it to expire. And I was like, I feel like we're all just making it up because I called Anavip and they were like, "No, when it expires, we send new and it's free. We don't charge the hospital." So
Wow.
they don't charge, and it's even on their website. When it expires, it takes 3 years to expire. When it expires, they send new batches for free. Well, then why? Like, I would pay just to have 2 vials just to get a starter dose,
Mhm.
Like, so I was like, "Oh my gosh, it needs to be like an EpiPen almost." I just feel like there needs to be a better way because they're not
Yeah.
keeping it, and if you could just get something in, not even 10 vials, just a little bit, and then have time to go somewhere that could actually fully take care of you, it's like crazy to me, and all it does is, like, scare a bunch of moms around here, and I'm scared. I'm like, "We're not hiking." Like, we're not
Yeah.
hiking. I feel like I've prepared a couple firefighters, but that's ab and nurses, but I feel like other than that, the actual system hasn't changed. So, yeah, that's kinda
Yeah.
my story.
And so
I'm
Briggs
always Go
Briggs
ahead.
has full like, he was totally recovered, correct? Like, he has full mobility and use of his right hand and arm.
Yeah, he had to do a lot of PT and OT, and we actually put him in school right after that because they were just doing the school just does a ton of little sensory activities. Even then, I was like, "Hey, what do we do for his hand?" They're like, "He's little, it'll heal," because he survived. And I was like, "Guys, he has contracture, like he can't move his hand. Like his thumb is frozen to his hand." I go, "He can't move it." And Dan's like, "Linz, I've been in football. I've had injuries and surgeries. You need to like stretch it." So I was like, "Oh my gosh, I am online like a crazy mom having to like research this stuff, which I don't
Yeah.
understand." So then I called Arizona again. I was like, what do they do? Oh, we immediately put him in physical therapy. We immediately put him in occupational therapy. We get that hand moving and that, or, those fingers moving. I was like, this is crazy. We tried to do the occupational therapy and the PT, and they're like, well, we really don't have kids this young. And so he's not really made for this clinic, even though it's a hand clinic. I go, well, I don't want to send him to a clinic. It's not a hand clinic. So if he's too young, I go, just let me take him once. He's potty trained. He was potty trained at 20 months. He's really responsible. Let me take him and we'll sit there and you tell me what to do. And then I'll take it home and I'll do it. I'm not asking you to treat this little kid in your adult clinic, but like, they're like, we just don't have anyone that young. And I'm thinking, well, then let's figure it out. I
I think
get it.
it's really hard. I've been in situations where I've had to advocate myself in the healthcare system, and I've been like, "I'm a doctor, and I work at this hospital, and if I hadn't have advocated for myself and that was still really hard, I could have died." I had
Yeah.
postpartum
Yeah.
preeclampsia, and I remember it was 3 a.m., and I'm feeding my baby, and I wasn't feeling right, and I just had this doom and glooms feeling like I need to call in and double check and go get checked. And I'm
Yeah.
on the phone and all I wanna do is sleep. I'm so tired, And I'm on the phone for an hour waiting at 3 a.m. just to get through to the nurse. And I'm trying to get through to labor and delivery. I'm like, can I please just talk to labor and delivery nurse? No, if you've already had your baby, then you have to talk to the on-call nurse. Just
Yeah.
waiting, and I even hung up and called back again. Can I please talk to labor and delivery? No, you need to talk to on-call nurse. And then finally she's like, I'm going to transfer you to labor and delivery. And I
Yeah.
almost hung up because all I wanted to do was sleep. And I'm like, I'm probably just being paranoid. It's fine. But they're finally
Yeah.
like, why don't you come in? So then I come in, I tell my husband, I'll bring him the baby. And I'm like, you take care of the babies. I'm going to drive myself to the ER or to go get checked at labor and delivery. And he was like, what? And I'm like, don't worry. I'll take care of it. So I get there and I get to the side door where you're supposed to go into labor and delivery. And then the security guy's not letting me in because you already had your baby. So why are you coming to labor and
Oh
delivery?
my
And I'm
God.
like, I
Yeah.
promise you that they told me to come in. I'm not trying to come in and steal a baby or something. So he finally lets me in. And then finally they're evaluating me and they're like, your blood pressure is fine. You're fine. We're worried about preeclampsia, but you're fine. And I'm like, but my liver really hurts. And my identical twin sister had this and she had HELP syndrome and almost died. And I just want to make sure. And so finally they checked my liver function tests and they're elevated. So then they're like, okay, I guess you can stay. And so then they're treating me for preeclampsia, but then they're telling me it's my gallbladder. And so the general surgery team's coming in trying to get my gallbladder taken out. And I'm like, I've never had gallbladder symptoms. So they're not even believing they have preeclampsia. And then 5 days later, when I was finally going to go home, the nurse comes in and checks my blood pressure. And they were supposed to discharge me earlier that day, but they're running really behind. So instead of going home before 3, it's like 4 or 5 o'clock. And finally, my blood pressure is like through the roof. And then they're
Gosh.
like, okay, you can go home. And I'm like, can I? Because now finally my blood pressure caught up, And so then I had to stay longer. Anyway, it's just frustrating how many times those
Right.
kind of things have happened to me. And I'm like, I
Mhm.
literally, if I had not been willing to stay on the phone, I could have died at home in my kitchen. If I wasn't
Mhm.
willing to say, like, no, I really feel like I need to be checked, I would have gone home and died in my kitchen. Like, people die of preeclampsia all the
Yeah.
time, and it's scary. I knew that something was wrong. I knew to push, but most people don't know. They say, oh, when your doctor says it's fine, and you don't need the PT or the OT, that, okay, I kind of thought you would, but I trust you, and that's really hard. That's something that's hard for me as the healthcare provider too. How do we make sure
Mhm.
people aren't falling through the cracks? What do you guys
Mhm.
Yeah.
think?
I always just listen to my patients because I feel like they generally will tell me what I need to know before I'll be able to see it or feel it clinically.
Mhm.
And I tell them that
Mhm.
too, and it empowers them to, you know, listen to their bodies because I think so often there's this blind trust that gets put in and it's like, well, if you can't see it, then it's probably fine. Well, no, you
Yeah.
know your body better than I do. And
Yeah.
so I always tell my patients, I will listen to you. I will definitely like take into account everything that you're feeling because like I said, more often than not, you'll tell me before I can see it.
Yeah, I think that's so important.
Mhm.
Yeah.
Yeah. Well, Lindsay, that is like insane. And I watched it kind of peripherally. I just don't even know how. I mean, you just sitting here talking about being in the ER, I'm like tearing up. I'm like, I just can't even imagine being in your shoes and having dealt with all of that. It's just insane to me.
I feel like I just was really mad at myself because I was like, I don't want to yell at anyone. I'm too nice, and I will never like yell at someone or blame someone for anything. There was a moment in that room where I was like, he's gonna die, and if Dan was in here, this would not be happening because Dan was like screaming, which is why he couldn't go in the ambulance. And like, Dan wouldn't have blamed anybody, but he's that person. It's like, what's taking so long, Where
Yeah.
I'm just trusting in them and I'm just patient and I never complain and that's me. And I was like, oh my God, he's going to die in here. Dan's never going to see him. And it's strictly because I don't want to yell. I don't want to scream at people. I don't want to be mean. And I'm like, that's actually hurting my child right now because I'm not screaming. And it's been 45 minutes and we're not getting anything done. Like nothing is being done. We're trying, we're attempting, but nothing's actually getting anywhere. And I know it's no one's fault, but I was just like, this is crazy to me. Because I had a friend that was like, whenever you're not getting help and you need to just scream. And I'm like, that's not me. I'm not an attention person. And I
Right.
don't want to be the crazy person in the ER, right? But I did for a sense be like, oh my God, I am failing my child because I don't want to hurt anyone's feelings, but something has to be done. So anyway, yeah, blind trust is definitely scary too. Yeah.
It's tough. And they do have studies that show when you scream and make your doctor uncomfortable and the team that you get worse care, and I get it
Mhm.
because now
Yeah.
we're on edge and we
Yeah.
can't think and we're in
Oh,
fight or
yeah.
flight too,
Yeah.
so I don't think that was the wrong thing, but yeah, trying to escalate the situation and to continue to
For
advocate
sure.
and to ask for more, it's tricky, and there's definitely a hierarchy there, and we get it wrong in medicine a lot,
Yeah.
unfortunately, so I appreciate
Yeah.
you sharing your story, that's really
Yeah.
interesting and a good reminder for us, as doctors
Yeah.
to take care and to listen and to prepare ourselves. I think
Right.
sometimes we do think, "Oh, there's a smarter guy that could take care of it," or "I'll just send it on," and I think sometimes
Mm.
we just keep punting and no one takes the responsibility, and that's how people fall through the cracks, so I think
Yeah.
that's
Yeah.
And I think the
a good
more that you talk
reminder.
about it and the more that we advocate and the more that we can do, I think that's what we've realized lately is that we can't wait for like the laws to get passed or for the doctors to do it. I mean, we just have to educate through this sort of channel, right? Through social media and
Yeah.
through just talking about things.
Definitely.
I
Well, we're
So
agree.
glad
thank
your
you so
baby's
much.
okay.
Thank
Yes.
What a crazy
Yes.
you.
story. And being from Utah, yeah, the rattlesnake thing is legit, so it's a scary deal.
Yeah.
Hits
Yeah.
close to
Yeah.
home.
Well, thanks for all of everything. Thanks for all the tips with ortho too. I think Aaron and I, like, we always are going to bat for like in these mom groups about expansion and stuff. And so it's good to hear from your perspective on how we can do better, you know?
Yeah.
So
Thanks so much
thanks
for
for all
having me.
that.
That was
Yeah.
great.
Cool. Anything else you want to share? Any ways to contact you?
Uh, yeah, you can. My office is iOrtho San Diego, but yeah, the reason I found out about the kid that had died the year before is because they saw it on the news. One of my friends is a newscaster, and they
Oh,
reached out to my office about
Oh,
the snake
wow.
stuff. And actually, my staff this Christmas got me a gift of like, donating anti-venom to like a village, like what she does. And so that's what because they know me. I don't like gifts. I don't need fancy wine. I actually want like purpose and stuff. And so that's what they got me for
Yeah.
Christmas. And they know it's definitely a passion of mine is like to make this not in vain and make something better for the future. But yeah, that's all. They can reach me at iOrtho San Diego, Dr. Lindsay Pfeffer, and you can Google me and call or email or whatever. But I'd be more than happy to talk to anyone about expansion or phase one or ortho or anything.
or
Even if
rattlesnakes.
yeah, or what else? I feel like I know
Yeah.
a lot about rabbits.
And no selling snake oils, just so that we're all clear.
Yeah, yeah, exactly right.
Awesome. All right. Thank you, Lindsay, so much. We really appreciate you. All
Thank
Thanks
you. Have
again.
a great day, guys.
right. You
Bye.
too.
Thanks for listening to another episode of the Resting Stitch Face podcast. If you enjoyed today's episode, the best way you can support us is by sharing it with a friend, leaving a quick review, or hitting follow so you don't miss what's next. We'll see you next time.